Hi, I am Dr. Felice Gersh, your integrative OBGYN physician. And today is Mother's Day. So happy Mother's Day to all of you moms out there. And whether you are a mom or hope to be a mom, you definitely had or have a mom. Now, I hope you have a mom because I have to say I'm always sad every day to some degree because I lost my mom quite a few years ago and I miss her a lot. So, those of you who are so fortunate to still have your mom in your life, I'm going to give you some advice on how to help your mom this day and every day to be the healthiest and optimally, hopefully, healthy longevity gal that she can be. So let's talk about different age groups because moms come in all different ages, right? So if your mom, if I'm talking to you and you happen to be a teenager in your 20s, you probably don't have to do too much for your mom at this stage, except encourage her to do all the things that she should be doing, like eating the right foods and not drinking too much alcohol, not engaging in risky behaviors, and getting a lot of fitness, going to bed at the right time without being bossy. Try to encourage her and live by example, like show her that you are doing the right things. Don't think that you can't influence your mom at any age. Well, let's say your mom is in the, we'll say 50 to 65 age range. Okay, well, what about her? Well, if you can, talk to her about making plans for the future. Now, I don't mean like imminent, but you just never know in life what anything can happen. So women between 50 and 65 sometimes do have issues. Sometimes they have sudden heart attacks or strokes or ruptured aneurysms. So it's really hard to talk about these things, but it's a good idea to just check with your mom to see that she has like all the plans in place for like what would happen if she had to have medical care and there was no one there to take care of her in terms of making decisions if it happened to be that she could no longer make decisions for herself. So make sure that all the correct papers are in order and that everything is right. She has a directive for the kind of care she wants if something should actually happen and she's not capable of making decisions for herself. These are hard, like I said, but these are discussions that should be made. Now, what about menopause? Well, if your mom is in the 50 to 65 age group, she is either perimenopausal or she's menopausal. You should have a chat with your mom about her experiences. It affects her and it affects you. In fact, the biggest predictor of when you'll go into menopause, if you're not there yet, is when your mom did. But not that that's an exact thing, of course, but it's the best predictor that there is. So find out what kind of a menopause your mom has had or is having. Does she have a lot of night sweats, hot flashes, mood swings? Does she have aches and pains, palpitations? Just find out because, first of all, you need to talk to her. If she doesn't know about hormones, she may not be as knowledgeable as you. And tell her hormones are really good as long as you get bioidentical and you get them in the proper dosing and delivery system. Okay. But tell her, don't be afraid of hormones. And if she is a physician who is afraid of hormones and won't provide them, then maybe she should look around and get a second opinion because hormones, as you know, are just like every other hormone, the female hormones from the ovaries, and you need them. That's why you have them. And it's not like at any age when you go through menopause, suddenly you don't need them. It doesn't work that way. So talk to your mom about her menopause and tell her that if she is having significant menopausal symptoms, and remember, hot flashes can last for years and years. The average is like around 7 years, and it depends on a lot of things, like the health that you have when you go into menopause, your genetics, and so on. But some women have hot flashes and night sweats for 20 years. So wherever she is in her menopausal journey, tell her she's having symptoms such as those, that she should be treated. Now, hormones are the gold standard, but there are other medications if for some reason she can't or won't take hormones. But having night sweats and hot flashes themselves or an increased risk factor, and also indicative of an increased risk factor for having heart attacks and strokes and dementia. So tell her, get them treated, and all the other symptoms as well. Universally, every woman at some point will get the genital urinary syndrome of the menopause, where she'll have incontinence of different types, bladder infections, vaginal dryness, vaginal infections, and painful intercourse. So talk to your mom. Ask her gently and to the degree that you feel comfortable, like, are you experiencing genital urinary syndrome of the menopause? Because if you are and you haven't had any treatment, please get treatment, because these are not good things to have for a whole host of reasons. So have the menopausal discussion with your mom if she's not forthcoming and bringing it up with you. Now, what about if she is in that age group and she is not getting the best medical care? Well, tell her, in that age group, it's time to have a primary care doctor, whether it's an internal medicine doctor, a family practice doctor, and occasionally an OBGYN will take on that role, but not commonly, because she needs to have a real record of her health care. She needs to have regular visits. At this time in life is when blood pressure starts to rise, cholesterol starts to go up, inflammation of aging is occurring, even when you're doing everything right. It's not a question of if, it's how much. So make sure she gets a really good doctor that she feels comfortable with and can get in contact with when help is needed. Also, if she's on any pharmaceuticals, whether over the counter or prescribed, make sure that you have a list of them. Make sure she has a list of them, that she writes them all down with the exact dose and regimen, so that if anything happens, it'll be readily available. Make sure you have a copy. Make sure she makes a copy if you have a dad or she has another partner. Make sure that person has a copy, so that if anything ever happens, it's clear what medications and how she's taking them and the dose that's available to relay to doctors taking care of her if something happens. Also, tell her to bring a list of everything she takes, including supplements, to every single doctor visit that she has, so that there's never a question of what she's taking. And like I said, make sure it includes over-the-counter medications and supplements, as well as prescribed medications. Now, I'd like you to have a chat with your mom about her lifestyle in a very kind and gentle way. Like, hey, mom, are you walking every day? What's your fitness? And maybe she can get a walking buddy. Could be her partner, or could be a friend, or she could go to a gym. There are, wonderful gyms everywhere. And she needs to try to get some exercise on a daily basis. So daily should be some degree of walking. I know there's that magical number of 10,000 steps, and that's actually somewhat arbitrary, but she should definitely get out and do walking on a regular basis. And it would be really nice if 3 times a week she could do some resistance training, because these are the years when women have increased risk for falls and fractures. So we don't want that to happen to your mom. No way. So try to get her to do resistance training and go to a gym and get some training in that way. And then she could do it either with a gym or on her own. And there are also online programs available. So we definitely want to keep those muscles and bones really strong and keep the joints limber. So what can do that? Yoga. So yoga is a great thing for your mom to try and see if she likes it. There are many gentle yoga programs, and it will help her to stay flexible as well as strong and limber, and will improve her balance, so she'll be less likely to fall and break bones. Fractures occur in over 50% of postmenopausal women, and they can be life-changing. Sometimes, especially in the older moms, life-ending. So that's a very, very big deal. So we don't want that to happen to your mom. So now what about her diet? Well, sometimes as women get older, they tend to cut corners and they eat a lot of processed foods to save time. They don't feel like cooking. What if they're an empty nester? Okay. Well, they feel, I don't have to cook for the kids anymore. I don't want to go to the trouble. So they do a lot of takeout. They buy convenience foods, often not very healthy foods. There are takeout foods that can be healthy, but that's not always what people choose. And often they'll skip the vegetables because, salads and vegetables take the most time to cut the vegetables and prepare them and so on. So sometimes they just skip it. It's easier to just boil pasta, but tell her, don't do it. And bread and jelly is a go-to for women as they age, but not good, okay? So talk to your mom about her diet. See if she's actually cooking or who's doing the cooking and what she's choosing. There are many, many options. There are a lot of grocery stores that will have salad bars where if she just won't do it herself, she can buy it. Of course, you pay a hefty premium financially for getting someone to cut up your lettuce for you. So look into that, though, if she just refuses to take the time to do the cooking and the preparation necessary to have a really optimally healthy diet. Ask her if she's snacking all day. That's another thing that women often do. They lose control of their appetite and they snack a lot. Try to get her to stop, but in a very gentle way. We don't want to come across as bossy and pushy to our moms. They would not appreciate that. Now, what if you have an older mom? We'll say 65 all the way up to 100 and plus 100. Well, these are the geriatric years. Now, these are the years when the most significant medical problems tend to occur. By age 65, 75% of women will have high blood pressure. By age 65, women surpass men in the incidence of strokes and ruptured aneurysms. And when they get a heart attack, which is not rare, they have a higher rate of dying from their first heart attack. Women make up 80% of autoimmune diseases. Women make up 80% of osteoporotic fractures that occur. Women have a higher rate of osteoarthritis and undergo more joint replacement surgeries than do men. Women have 2.5 times the incidence of Alzheimer's dementia compared to age-matched men, like age for age, the same age. Women have 2.5 times the incidence of Alzheimer's disease. So these are the years, 65 plus, when you may find your mom is suffering from one or more of these issues. So talk to her about these things. See if she seems to be forgetful, if she's having problems with navigating through life. She may have early signs of dementia. Now, there are no great drugs, but lifestyle has been shown to be very beneficial. Like the Dale Bredesen Reversing Alzheimer's program is actually very functional in terms of benefiting, and do the best you can to get her to exercise, work on stress, work on sleep, and so forth. Eating the right foods can actually slow and even reverse, especially early stages of cognitive impairment and the early stages of dementias in some cases. Also, there's sometimes people get dementias because of really treatable things like B12 deficiency. So, of course, these things need to be checked. And, the worst, of course, is if someone has a brain cancer or brain tumor. She needs health care. If you notice that she is cognitively declining, make sure she gets a thorough evaluation. No jumping to conclusions, a thorough evaluation. And if she has high blood pressure, don't underestimate the value of certain supplements, like even magnesium and a multivitamin and supplements that increase nitric oxide and NAD. These can actually help to reverse or at least reduce hypertension. And if she is prescribed a drug for hypertension, please make sure she takes it. These drugs can be life-saving. Hypertension underlies all kinds of problems with vascular dementia, strokes, and heart attack. So hypertension must be treated if she has it. Diabetes and prediabetes start to really ramp up their incidence in this age group. So make sure she gets proper lab testing and, go with her. If you live near her and you can, maybe go with her to a doctor's appointment if she's willing to let you, or at least talk with her before and after if she's willing to let you. And now we're particularly talking about women who are geriatric. And geriatric women are all different types too. Some really need a lot of overseeing and direction, and others are doing everything that they can on their own. They're amazing and they're living independently, making all their own decisions, driving up until their late 90s. So, you know your mom. I'm just talking in general terms here, just in case your mom is one of the needier ones. And even the ones that are not very needy, they're just doing everything right. It's not a bad idea to just, pat them on the back then and say, gee, mom, I'm so proud of you. You're making all these wonderful lifestyle choices and look how healthy you are. It's amazing. And do fun stuff. One of the things that happen as people age, which is really hard, is that they lose their friends and their relatives who are in their same age demographic. That is so painful when they are aging, even when they're doing great, but they lose their companions and they become lonely and depressed. So see how your mom is doing. Does she have a social life? Is she going out? Is she doing things? Is she losing her friends either to illness, chronic disease, or death? And also like her peer group that is maybe like her cousins and such that are in her age group. These are really hard things. I remember watching my mom age, and I had to be her caregiver as she got really elderly and was getting close to her mid-90s, and she had some medical problems, and I was there for her. And it was a hard couple of last 2 years, I have to admit, but I would never have given them up because being there for your mom and when she gets really elderly is so wonderful and important. And it will just, just make a wonderful little spot in your heart that you'll never forget that you were there for your mom. And talk to her about things that she may want to talk about and has no one else to talk to about. I know when I had my mom that I was with a lot, and she was so sad because it was like she was going to a funeral. My mom got into her mid-90s, and also her sister, who lived to be 97, I lost her a year ago. Um, they told me, both of them, how sad it was that so many of their friends developed dementias, that they essentially lost them to dementia, or they had died and they were going to their funerals, or their spouse died and then they went into assisted living, and then or they moved in with their children, never to be seen by my mom again, or my aunt or sister. And it's so sad and so painful. So depression and loss and loneliness are big drivers of illness in people as they age, of course, at all age groups, but especially in the elderly. And so see if you can help your mom. Maybe look for a senior center, a place where she can go meet new people. It's not easy when you're in your late 60s, 70s, 80s, 90s to keep making new friends, to replace friends that you may have had for decades. It's not, you can't really replace them, but you have to make new friends and you have to help them because loneliness is an increase, a huge increase risk for dying, I can just leave it at that, and having heart attacks. So see how your mom is doing. If you live near your mom, try to see her on a regular basis. I know you're busy, but try. And if you don't live near your mom, do FaceTime, calls, texts, things like that. Stay in touch and have conversations. We have electronic means of communication. There's no reason not to. So your mom needs you as she gets really elderly into her 80s and 90s. She really does. And don't underestimate that need for love and companionship, and see what your mom is up to. Like, is she living with your dad or another partner? Is she living alone? Can she care for herself? How do you know when it's time to talk to your mom about maybe she shouldn't be driving anymore? Maybe she should go into assisted living or move in with you. These are things that are very personal and individualized. But check on your mom. See and evaluate for yourself and with her what her needs are, what her capabilities are as she gets into the very later years of life so that she can stay safe and she can stay happy and not lonely. And make sure she too has a list of all her pharmaceuticals as a directive for how she wants her care to be delivered should something happen and she couldn't make a decision. Make sure she understands what she is taking and why she's taking pharmaceuticals. Make sure she knows what her diagnoses are. And at least you should have a copy of all of those things, her diagnoses, all her medications, any supplements, and check on her to be sure she's actually taking them correctly. So being a daughter of a mom at any age is a big deal. And moms and daughters are so special. There's a bond that is so incredible between moms and their daughters. So on this Mother's Day, celebrate your mom. Tell her how much you love her. Maybe you can even spend time with her or you have spent time with her. But if not, if that was not feasible, just check in and send her, your love and be there for her as she ages because she really does need you. Happy Mother's Day.